Hello everyone, welcome to AD Academy. We will discuss auxiliary midwife grade 2 previous year question papers. The maximum question papers included with explanatory notes. Video like comment channel subscribe video okay, so it's a mega marathon video. You can take notes and also you can learn with me. Yeah, first question. Diets containing over 30% of kesari dal will result in dash. Okay, that's the answer. It is option B. It is letharism. That is the reason. Kesari dal contains a neurotoxin called ODAP. That is large quantity we consume that leads to a condition called neuroletharism. Next, following are the milk-borne diseases except diphtheria, tuberculosis, brucellosis, anthrax. Three options are there. So, the answer is option D, anthrax. Why? So, while anthrax is a zoonotic disease, it is primarily transmitted through direct contact with infected animals or hides rather than being a standard milk-borne infection like brucellosis or tuberculosis. Okay, except ആണ് ചോദിച്ചിട്ടുള്ളത്. ഇതേപോലെ PSL questions വരുമ്പം ആണോ അല്ലേ നമുക്ക് doubtful ആയിരിക്കാം. പക്ഷെ questions നന്നായി വായിച്ചു കഴിഞ്ഞാൽ നമുക്ക് ആ ഒരു doubt മാറുന്നതായിരിക്കും. So, option D, anthrax. Next, addition of vitamin A to dalda is an example of dash. It's option C, food fortification. എന്താണ് food fortification? That is the process of adding micronutrients to food to improve its nutritional quality. Okay. Next, vaccination of a portion of population provides protection to unprotected individuals is dash. But then it is herd immunity. So herd immunity occurs when a large part of population is immune to a disease, making it spread unlikely and thereby protecting those who are not immune. That is herd immunity, which is option D. Okay, the reason is a community. Okay, for a district namukku edukam adilloru 50% aalkarum vaccinated aanu. Okay, potte oru 70% aalkarum vaccinated aanu, so they can resist the disease. അപ്പം അത് ബാക്കി പലരിലേക്കും പകരാനായിട്ടുള്ള ചാൻസ് കുറയും. അതുകൊണ്ടാണ് അതിനെ ഹേർഡ് ഇമ്മ്യൂണിറ്റി എന്ന് പറയുന്നത്. ഹേർഡ് എന്ന് പറഞ്ഞാൽ എന്താ, ഒരു കൂട്ടമായിട്ട് നമുക്ക് കാറ്റലിന്റെ കൂട്ടത്തിനാണ് നമ്മൾ ഹേർഡ് എന്ന് പറയുന്നത്. അപ്പം അതുപോലെ നമുക്ക് പഠിച്ചു വെക്കാം. Okay, that is known as herd immunity. Next, an epidemic occurring over a very wide area and usually affecting a large number of people is called, it's a pandemic. So a pandemic is an epidemic that has spread across multiple countries or continents. Next, the number of live births per 1000 estimated mid-year population in a given year is called dash. It's known as birth rate. Live birth per 1000 estimated mid-year population. So this is known as the crude birth rate, CBR. It's known as crude birth rate. Terms of Next, pernicious anemia is due to the deficiency of, which one? It is option C, vitamin B12 or vitamin B complex. So pernicious anemia is a type of vitamin B12 deficiency anemia. So it occurs when the body cannot absorb enough B12 from food because it lacks intrinsic factor, a protein made in the stomach. Next, the national target is to provide one trained DAI per dash population. So DAI എന്നുള്ളത് എന്താ term നമുക്ക് check ചെയ്യാം. So answer എന്ന് പറയുന്നത് എന്താണ്? It is 1000 population. Okay, so the national target is to provide one trained DAI per 1000 population. So under national health norms in India, the target is to have one trained birth attendant. DAI എന്ന് പറയുന്നത് എന്താണ്? It is a trained birth attendant or TBA, or it's known as DAI. അപ്പം അത് എത്രയിൽ വേണം? For every 1000 rural population or per village. Next, which of the following international health agencies promoted a GOBI campaign? What is GOBI campaign? It is UNICEF, option D. Okay, the GOBI campaign endanu nokkam. It was a campaign that primarily healthcare strategy launched by UNICEF in the 1980s. It stands for growth monitoring, oral rehydration, breastfeeding and immunization. 10th, Nikshay is a newly launched central government software. It's used for tracking dash. അപ്പം Nikshay എന്നുള്ള central government software എന്തിനുള്ളതാണ്? To monitor or to track tuberculosis ക്ഷയരോഗം ട്രാക്ക് ചെയ്യാൻ വേണ്ടിയിട്ടാണ്. So Nikshay is the web-enabled patient management system used by the National Tuberculosis Elimination Program (NTEP). We have already discussed this in previous video. Okay, in India to monitor and track TB patients. Okay, tuberculosis ഉള്ള പേഷ്യൻസിനെ കണ്ടെത്താൻ വേണ്ടിയിട്ട് അല്ലെങ്കിൽ ട്രാക്ക് ചെയ്യാൻ വേണ്ടിയിട്ട് യൂസ് ചെയ്യുന്ന സെൻട്രൽ ഗവൺമെന്റ് ലോഞ്ച് ചെയ്ത സോഫ്റ്റ്വെയർ ആണ്. Aedes aegypti transmit dash. Option C. Chikungunya hemorrhagic fever ആണ് Aedes aegypti കൊതുക് പരത്തുന്നത്. The Aedes aegypti mosquito is a primary vector of several viral diseases including dengue, chikungunya and Zika. Next, principles of primary healthcare includes all except എന്നാണ് ചോദിച്ചിട്ടുള്ളത്. നമുക്ക് ഓപ്ഷൻസ് ആയിട്ട് വരുന്ന സസ്റ്റൈനബിൾ ഡെവലപ്മെന്റ്, ഇക്വിറ്റബിൾ ഡിസ്ട്രിബ്യൂഷൻ, community participation, intersectoral coordination. Answer is sustainable development. Explanation. The four core principles of primary healthcare PHC is equitable distribution, community participation, intersectoral coordination and appropriate technology. Not sustainable development. Next question. In RMNCH plus A strategy, what does plus A stands for? The answer is option B, adolescent health. Why? So in RMNCH plus A stands for reproductive, maternal, newborn, child and adolescent health. So plus A indicate ചെയ്യുന്നതാണ് adolescent health. A എന്നുള്ളത് ആലോചിക്കാം. Next, single massive dose of vitamin A for preventing the deficiency in children between the age of 16 years for every 6 months is dash. Option C, 2 lakh IU. So for children between 1 and 6 years of age, a dose of 2 lakh IU is administered every 6 months to prevent deficiency. Here IU refers to international unit. So 2 lakh international unit is administered every 6 months to prevent deficiency. Next, in pulse polio immunization program, VVM or vaccine vial monitor to maintain the cold chain. Which of the following indication to discard the vaccine is? So option D is the answer. Inner square darker than the outer circle. പൾസ് പോളിയോ ഇമ്മ്യൂണൈസേഷൻ പ്രോഗ്രാമിൽ BV എന്ന് പറയുന്നത് നമ്മൾ എന്താ വാക്സിന്റെ ക്വാളിറ്റി ചെക്ക് ചെയ്യുന്ന അല്ലെങ്കിൽ കോൾഡ് ചെയിൻ ഇതിന്റെ സ്റ്റോറേജിനാണ് നമ്മൾ പറയുന്നത്. സോ ഇന്നർ സ്ക്വയർ ഡാർക്കർ ദാൻ ഔട്ടർ സർക്കിൾ എന്ന് വന്ന ഒരു സിറ്റുവേഷൻ വരികയാണെങ്കിൽ so it is a VVM. So vaccine vial monitor is a heat sensitive label. If the inner square is the same color or darker than the outer circle, the vaccine has reached its end point and must be discarded. ആ vaccine പിന്നെ യൂസ് ചെയ്യാൻ പാടില്ല എന്നുള്ളതാണ്. അപ്പോൾ ക്വാളിറ്റി വാക്സിന്റെ ക്വാളിറ്റി ചെക്കിന് യൂസ് ചെയ്യുന്നതാണ് വാക്സിൻ വിയൽ മോണിറ്റർ എന്ന് പറയുന്നത്. ഓക്കെ, സോ ഓപ്ഷൻ ഡി ഇന്നർ സ്ക്വയർ ഡാർക്കർ ദാൻ ദി ഔട്ടർ സർക്കിൾ ആണെങ്കിൽ നമുക്ക് ആ വാക്സിൻ യൂസ് ചെയ്യാൻ പാടില്ല. Channels of communication includes except ഒഴികെയുള്ളതാണ് ചോദിച്ചിട്ടുള്ളത്. റിസീവർ, മാസ് മീഡിയ, ഇന്റർപേഴ്സണൽ കമ്മ്യൂണിക്കേഷൻ, ഫോക്ക് മീഡിയ. സോ എന്താണ് ചാനൽ ഓഫ് കമ്മ്യൂണിക്കേഷൻ? ഒരു റിസീവർ ഒരു ചാനൽ ആണോ ഓഫ് കമ്മ്യൂണിക്കേഷൻ? No. So in the communication process, the receiver is the person who gets the message. Mass media, interpersonal and folk media are the channels. Okay, അതിനാണ് നമ്മൾ ചാനൽ എന്ന് പറയുന്നത്. ഒരു റിസീവർ ഒരിക്കലും is a person who receives the message, not a channel used to deliver the message. So option A, receiver. Which method is used for HIV post-testing counsel? It is option D, that is individual approach. So due to the sensitive and confidential nature of HIV testing, counseling is conducted on a one-on-one basis. Okay, it should be confidential. Or mass media or a group approach should be one-on-one counseling. Okay. Next, Hygeia is a Greek word which means This a goddess of health. Hygeia I think it should be pronounced as Hygeia, so you can check it how to pronounce that. It's a Greek term. It is goddess of health. In Greek mythology, Hygeia, the origin of the word hygiene. Okay, hygiene ennulla word Hygeia ennulla oru Greek term ninnaanu vannittulladu. So Hygeia was a goddess of health, cleanliness and sanitization. Health in cleanliness and sanitization okke oru devadayarunnu aa Hygeia. Aa oru term ninnaanu goddess of health ennulla meaning vannittulladu. Then fear of closed space. അടഞ്ഞ ലിഫ്റ്റിനുള്ളിലൊക്കെ പെട്ടെന്ന് നമ്മൾ ഒരു പേടി അല്ലേ, അതിനോടൊരു ഫോബിയ എന്ന് പറഞ്ഞാൽ അതിനോടൊരു പേടിയാണ്. മാനിയ എന്ന് പറഞ്ഞാൽ നമുക്ക് അതിനോടുള്ള കൂടുതൽ ഇഷ്ടമാണ്. അപ്പൊ അതൊന്ന് നോക്കുക. സോഷ്യൽ ഫോബിയ, അഗോറോഫോബിയ, ക്ലോസ്ട്രോഫോബിയ, എക്രോഫോബിയ. അപ്പൊ നമുക്കറിയാം ക്ലോസ്ഡ് സ്പേസ് എന്ന് പറയുമ്പോൾ എന്താണ്? ദാറ്റ് ഇസ് ഓപ്ഷൻ സി, ക്ലോസ്ട്രോഫോബിയ. അങ്ങനെ ആലോചിക്കാം. So claustrophobia is the irritational fear of confined or enclosed spaces. Okay, what are the manias? Pyromania എന്താന്ന് പറയും? Pyromania, can you guess it? സാധനങ്ങൾ എടുത്ത് കത്തിക്കാനുള്ള ഒരു ഇഷ്ടമാണ്. കമ്പൾസീവ് ഒബ്സഷൻ ആണ്. നെക്സ്റ്റ്, all are examples of macronutrients except. അപ്പം അല്ലാത്തതാണ് ചോദിച്ചിട്ടുള്ളത്. പ്രോട്ടീൻസ്, മിനറൽസ്, കാർബോഹൈഡ്രേറ്റ്സ്, ഫാറ്റ്സ്. ആൻസർ വരുന്നത് എന്താണ്? മിനറൽസ് ആണ്. ഓക്കെ, protein, carbohydrates and fats are macronutrients, where minerals and vitamins considered to be micronutrients. Minerals ഉം vitamins ഉം micronutrients ആണ്. Protein, carbohydrate, fat ഒക്കെ എന്താണ്? Macronutrients ആണ്. Which of the following body system is related to hormone production? Hormone production related ആയിട്ടുള്ള body system ഏതാണ്? It is option C, endocrine system. Endocrine glands ആണ് hormones നമ്മുടെ ബോഡിയിൽ secrete ചെയ്യുന്നത്. Okay, that is comprised of glands like thyroid and adrenal glands that secrete hormones directly into the blood. Fear of gaining weight and significant body image disturbance is, it is option C, anorexia nervosa. പെട്ടെന്ന് വെയിറ്റ് കൂടുമോ എന്നുള്ള പേടി, അതുപോലെ തന്നെ നമ്മുടെ ശരീരം കാണുമ്പോൾ തന്നെയുള്ള ഒരു ഡിസ്റ്റർബൻസ്, അതാണ് anorexia nervosa. This is a characteristic symptom of anorexia nervosa, where individuals have an intense fear of weight gain and a distorted view of their own body. അവർക്ക് അവരുടെ ഒരു ബോഡിയെ പറ്റിയിട്ടാണ് ഒരു കോൺഫിഡൻസും ഉണ്ടായിരിക്കില്ല. That is anorexia nervosa. Next question, improper waste disposal leads to. Options are malnutrition, psoriasis, mosquito-borne disease, xerophthalmia. So option C is the answer, mosquito-borne disease. നമ്മൾ വേസ്റ്റ് കൂടുതൽ കൂട്ടിയിട്ട് കഴിഞ്ഞാൽ അവിടെ കൊതുക് പെരുകാനുള്ള സാധ്യതയുണ്ട്. സോ poor waste management creates breeding grounds for vectors like mosquitoes which spread disease like malaria and dengue. Xerophthalmia എന്ന് പറയുന്നത് കണ്ണിൽ നിന്നും tears വരാത്താണ്. Psoriasis, skin disease and also malnutrition, deficiency of nutrition. Next, birth weight of a normal newborn human baby is option B, 2.5 kg to 4 kg വരെ ആണ് വെയിറ്റ് വരാവുന്നത്. Next, unhygienic water supply leads to option C, cholera. അപ്പം contaminated വാട്ടറിൽ നിന്നും വരുന്ന സ്പ്രെഡ് ആവുന്ന ഒരു രോഗം, ഡിസീസ് ആണ് കോളറ. സോ കോളറ is a waterborne disease caused by ingesting contaminated water or food. Next, which is the biggest organ in the body? It is skin. It has the largest organ of the body and the liver is the largest internal organ. Okay, external ആയിട്ട് നമുക്ക് സ്കിൻ എന്നും പറയാം. ഇന്റേണൽ ഓർഗൻ വെച്ച് നോക്കുമ്പോൾ ഉള്ളത് ഏതാണ്? That is liver. An example of antipsychotic is dash. Antipsychotic ആയിട്ട് യൂസ് ചെയ്യുന്നതാണ് എന്താണ്? It is option B, haloperidol. It is a typical antipsychotic medication used to treat schizophrenia and other psychosis. Beriberi is the deficiency of dash. Option A, vitamin B1 or thiamine deficiency leads to beriberi, which affects the heart and circulatory system of the nerves. Which of the following is not a feature of poor mental health? Poor mental health ന്റെ ഫീച്ചർ അല്ലാത്തതെന്നാണ് ചോദിച്ചിട്ടുള്ളത്. ഫീലിംഗ് ഡിപ്രസ്ഡ്, അത് poor mental healthന്റെ ഒരു ഇൻഡിക്കേഷൻ ആണ്. ഫീലിംഗ് വർത്ത്ലെസ്, ഫീലിംഗ് ഹാപ്പി, ഫീലിംഗ് ഗിൽറ്റി. എന്താണ് ഫീലിംഗ് ഹാപ്പി? ഹാപ്പി ആയിട്ടുള്ള ഒരാൾ ഒരിക്കലും ഹാസ് നോ poor mental health. So option C. Next, echolalia, which means dash, which is the repetition of words of examiner. So echolalia is the involuntary repetition of another person's spoken words, which is not included in defense mechanism. Denial, substitution, undoing and hypnotism. So defense mechanism use cheyathana endu hypnotism. So denial, substitution and undoing are psychological defense mechanism, where hypnotism is a therapeutic technique. Next, an example of foodborne disease is dash. It is cholera. Food and water ninnu allengi contaminated water ninnu spread cheyyunna oru disease aanu cholera. Okay. Which of the following is not a source of protein? പ്രോട്ടീൻ്റെ സോഴ്സ് അല്ലാത്ത ഏതാണ്? ഗീ. നമുക്കറിയാം പൾസിലും മിൽക്കിലും മീറ്റിലും ഫിഷിലും ഒക്കെ പ്രോട്ടീൻ ഉണ്ട്. സോ ഗീ ഈസ് ഓൾമോസ്റ്റ് എൻറ്റയർലി ഫാറ്റ് ആണ്. ഗീ എന്ന് പ്രൊഡ്യൂസ് ചെയ്യുന്നത് എന്താണ്? ദാറ്റ് ഇസ് ഫാറ്റ്. All are the types of hallucination except അല്ലാത്താണ് ചോദിച്ചിട്ടുള്ളത് auditory, olfactory, visual and illusion. So a hallucination occurs without an external stimulus, while an illusion is a misinterpretation of real stimulus. Next, time interval between invasion by an infectious agent and appearance of first symptom is named as dash. That is known as the incubation period. അതായത് that's a time taken for an infection to develop after an individual is exposed to a disease causing agent. ഒരു disease causing agent ശരീരത്തിലേക്ക് കടന്ന് അതിനെ like ആ individual infection spread ചെയ്യാൻ എടുക്കുന്ന ഒരു ടൈമാണ്, that is incubation period. High biological value protein is present in dash. Eggs and meatലാണ് നമുക്ക് കൂടുതൽ പ്രോട്ടീൻ ഉള്ളത്. അപ്പോൾ അതൊന്ന് ഓർത്ത് വയ്ക്കാം. So proteins from animal sources like eggs and meat contain all the essential amino acids in the right proportions for the human body, giving them a high biological value. അപ്പം എഗ്ഗിലും അതുപോലെ തന്നെ മീറ്റിലും എന്തുണ്ട്? അമിനോ ആസിഡ്സ് ഉണ്ട്. അത് ഹ്യൂമൻ ബോഡിക്ക് ആവശ്യമായിട്ടുള്ള എസെൻഷ്യൽ പ്രോട്ടീൻസ് നൽകുന്നതായിരിക്കും. Which of the following is not a live vaccine? Live vaccine അല്ലാത്തത് ഏതാണ്? It is option D, rabies vaccine. So the rabies vaccine used for humans is an inactivated or killed vaccine. Oral polio, PV, measles and BCG are all live attenuated vaccines. Next, a male patient aged 45 years complains of urgency of urination and dribbling of urine. What should he be suspected of suffering from? It's option A, benign prostatic hypertrophy. So we can call it as BPH. It's a common condition in men as they age, where the prostate gland enlarges, leading to urinary symptoms like urgency, weak stream and dribbling. 39. What is the acronym of FAST in stroke stands for? ഒരാൾക്ക് stroke വന്നു കഴിഞ്ഞാൽ അതിൽ FAST എന്താണ്? So option B, face, arms, speech, time. So this is a mnemonic to help detect and respond to the signs of stroke. Face drooping, arm weakness, speech difficulties, time to call emergency service. If three symptoms ഉണ്ടെങ്കിൽ we can consider it as a stroke. Next, Mission Indradhanush by Union Ministry of Health and Family Welfare focus on option A, full immunization for children. So ഈ ഒരു Union Ministry of Health launch ചെയ്ത ഒരു മിഷൻ Indradhanush is launched in 2014 and this program aims to ensure full immunization coverage for all children and for pregnant women as well in India. Next, night blindness is caused by the deficiency of very simple vitamin A. Vitamin A is essential for the production of rhodopsin, that is a pigment in the eyes that allows you to see in low light conditions. So rod cells and con cells are that. So rhodopsin production ആണ് vitamin A. അതുകൊണ്ടാണ് നമുക്ക് night blind. അതിന്റെ deficiency വന്നാലാണ് നമുക്ക് night blindness ഉണ്ടാകുന്നത്. Next, color code of plastic bag for disposing microbial lab culture waste is dash. അപ്പം മൈക്രോബിയൽ ആയിട്ടുള്ള ലാബ് വേസ്റ്റ് ഇതിലാണ് കൊടുക്കുന്നത്, നമ്മൾ റെഡിലാണ് കൊടുക്കുന്നത്. ഇറ്റ്സ് എ പ്ലാസ്റ്റിക് ബാഗ്. പ്ലാസ്റ്റിക് ഒക്കെ നമ്മൾ റെഡ് ബിന്നിലാണ് ഇടുന്നത്. സോ വൈൽ മോഡേൺ ഗൈഡ് ലൈൻസ് ഓഫൺ യൂസ് യെല്ലോ ഫോർ ഇൻഫെക്ഷൻസ്. അപ്പം യെല്ലോ നമ്മൾ യൂസ് ചെയ്യാറുണ്ട്, യെല്ലോ ഫോർ ലാബ് വേസ്റ്റ്, ഇൻഫെക്ഷസ് ലാബ് വേസ്റ്റ്. ഇൻ മെനി സ്റ്റാൻഡേർഡൈസ്ഡ് നഴ്സിംഗ് ആൻഡ് മെഡിക്കൽ എക്സാംസ് where yellow is not an option, where red is the designated choice for contaminated or infected plastic waste or lab cultures. A rapid global outbreak of an infection initiated from a single focus is termed as dash. അപ്പം COVID is a pandemic എന്ന് പറയാറുണ്ട്. അപ്പം എന്തുകൊണ്ടാണ്? That is an epidemic. പകരുന്ന becomes a pandemic അല്ലെ, വേൾഡ് വൈഡ് ആയിട്ട് സ്പ്രെഡ് ചെയ്യുന്ന ഒരു അല്ലെങ്കിൽ സെവറൽ കൺട്രീസ് അല്ല അതുപോലെ കോണ്ടിനെന്റ്സിലേക്കും പകരുന്ന ഒരു ഡിസീസ് ആണ്, ഒരു ഇൻഫെക്ഷൻ ആണ്, affecting a large number of people globally. That can be known as pandemic. Which among the following statement is true with the tab? Digoxin. So it's a tablet. So option A, take tab digoxin along with meal. Check the pulse rate before taking tab digoxin. Increase fluid intake while on tab digoxin. Count respiratory rate before taking tab digoxin. So correct answer is option B, ഈ മരുന്ന് നമ്മൾ എടുക്കുമ്പോൾ എന്ത് നോക്കണം? പൾസ് റേറ്റ് നോക്കണം. സോ ഡിഗോക്സിൻ സ്ലോസ് ദ ഹാർട്ട് റേറ്റ്. ഇറ്റ് ഈസ് സ്റ്റാൻഡേർഡ് പ്രാക്ടീസ് ടു ചെക്ക് ദ epical pulse for 1 full minute. The dose is typically withheld if the heart rate is below 60 beats per minute. 60 beats per minute ഒക്കെ ഉള്ളെങ്കിൽ നമുക്ക് ഈ മെഡിസിൻ കൊടുക്കാൻ പറ്റില്ല. സോറി, അതിനും കുറവാണെന്നുണ്ടെങ്കിൽ. Because this medicine slows our heartbeat. Next, type of illness in which the signs and symptoms occur suddenly and last for a short period of time is called acute disease. Okay, signs and symptoms പെട്ടെന്ന് അതേപോലെ ഒരു ഷോർട്ട് പീരീഡ് ഓഫ് ടൈമിൽ മാത്രം എക്സിസ്റ്റ് ചെയ്യുന്നുണ്ടെങ്കിൽ നമുക്ക് അതിനെ acute disease എന്ന് പറയാം. Where acute conditions have a rapid onset and short duration, whereas chronic conditions എങ്ങനെയാണ്? അത് സ്ലോ ആയിട്ട് വന്ന് ഒരുപാട് കാലം പെർസിസ്റ്റ് ചെയ്യും ബോഡിയിൽ. Next, which among the following drugs is used to prevent transmission of HIV from infected pregnant women to newborn? അപ്പം HIV ഉള്ള മദറിൽ നിന്നും കുട്ടിയിലേക്ക് പകരാൻ സാധ്യതയുണ്ട്, അല്ലെ ന്യൂബോൺ ബേബിയിലേക്ക്. അപ്പം അതിന്റെ ഡ്രഗ് ഏതാണ് യൂസ് ചെയ്യുന്നത്? ദാറ്റ് ഇസ് ഓപ്ഷൻ എ, നെവിറാപൈൻ. Nevirapine is a common antiretroviral medication used in prevention of mother-to-child transmission (PMTCT) protocols. Next, Vidal test is carried out in the diagnosis of Vidal test. ഏതിനാണ് നോക്കുന്നത്? ടൈഫോയിഡിനാണ്. ടൈഫോയിഡിനുള്ള ടെസ്റ്റ് ആണ്. So the Vidal test is a classic serological test used to detect Salmonella typhi. That's the bacteria responsible for typhoid fever. Bacterial fever ആണ്. Okay. Bacterial infection associated with the increased risk of peptic ulcer disease. That is option B, Helicobacter pylori. That's the primary bacterial cause of stomach inflammation and peptic ulcer. Ulcer വരുന്നതിന് അതുപോലെ stomachലെ inflammation വരുന്ന bacteria ആണ് Helicobacter pylori. Next, drug of choice in the management of organophosphorus poisoning is dash. It is option C, atropine. Atropine acts as an antagonist to the effects of excess acetyl. Drug of choice in the management of organophosphorus poisoning is dash. Atropine is used where it acts as an antagonist to the effects of excess acetylcholine caused by organophosphate pesticides. Test dose of penicillin is administered through which among the following routes? Penicillin എങ്ങനെയാണ് കൊടുക്കുന്നത്? That is intradermal. Okay. Reason എന്തുകൊണ്ടാണ്? Sensitivity testing for penicillin is done via an intradermal injection just under the top layer of skin. സ്കിന്നിന്റെ തൊട്ടടിയിലുള്ള ലെയറിലേക്ക് കൊടുക്കുന്ന ഇഞ്ചക്ഷൻ ആണ് to watch for a localized allergic reaction. Which among the following manifestation necessitate emergency intervention in a patient with femur fracture? Femur എന്ന് പറഞ്ഞാൽ തൊടയിലാണ്, തൊടയിൽ ഫ്രാക്ചർ ആയിട്ടുള്ള ഒരു പേഷ്യന്റ് എമർജൻസി വന്നാൽ എന്താണ് ചെയ്യുന്നത്? That is dyspnea. That's shortness of breath in a patient with a long bone fracture like the femur is red flag for a fat embolism, which is a life-threatening emergency. Chest compression to ventilation ratio in one rescuer CPR for children is ratio is 30:2. For a single rescuer adult or child or infant, the universal ratio is 30 compressions to 2 breaths. The ratio changes to 15:2 for children or infants only when there are 2 rescuers. Which among the following is the most common cause of pathological fracture in elderly women? Option C, osteoporosis. Osteoporosis causes bones to become weak and brittle. പെട്ടെന്ന് പൊട്ടാൻ സാധ്യതയുള്ള അതുപോലെ വളരെ വീക്കായി വരും. അത് കാണുന്നത് കൂടുതലും elderly womenലാണ്. Make them much more likely to fracture, especially in post-menopausal women due to hormonal changes. menopause ഉള്ള ഒരു കണ്ടീഷൻ ആയ ഒരു women അവിടെ ഹോർമോൺ ചേഞ്ചസ് കൂടുതലായിരിക്കും. So they will be more vulnerable to the situation. Next, the specimen of urine required for culture and sensitivity test is option B, midstream urine. Reason, a midstream clean catch sample is used to ensure the specimen isn't contaminated by bacteria from the skin or the start of the urine stream. The major hormone secreted by the corpus luteum in the luteal phase of menstruation is dash. It is progesterone. Ovulation കഴിഞ്ഞതിന് ശേഷം corpus luteum produces high levels of progesterone to prepare and maintain the lining of uterus for a potential pregnancy. So അതിൽ secrete ചെയ്യുന്ന hormone ആണ് progesterone. The psychological development stage of an adolescent is ഏതായിരിക്കാം? It's option A, that is identity versus role confusions. Where according to Erik Erikson's stage of development, adolescents age എന്താണ് 12 to 18 go through this stage as they search for a sense of self and personal identity. The National Deworming Day in India is observed on option B, February 10th and August 10th ആണ്. എന്താണ്? India observes National Deworming Day twice a year on these specific dates to reduce the prevalence of soil transmitted helminths or parasitic worms in children. February 10th and August 10th. That is National Deworming Day in India. The article of Indian Constitution that provide the right to be protected from hazardous employment till the age of 14. ഫാക്ടറിയിലുള്ള hazardous ജോലിയിൽ നിന്ന് കുട്ടികളെ അല്ലെങ്കിൽ occupational അങ്ങനത്തെ occupation നിന്ന് കുട്ടികളെ രക്ഷിക്കുന്ന ഒരു ആർട്ടിക്കിൾ ഏതാണ്? It is Article 24. Option D, Article 24. Specifically prohibits the employment of children below the age of 14 in factories, mining and any other hazardous occupation. The recommended site for the administration of BCG vaccine എവിടെയാണ് കൊടുക്കുന്നത്? BCG നമുക്ക് എല്ലാവർക്കും അറിയാം. It is on the left upper arm. It's a vaccination for tuberculosis and is standardly administered intradermally in the left upper arm to ensure consistency for future medical checks. The color code given to illness that require urgent pre-referral treatment and referral in integrated management of newborn and childhood illness is option A, that is pink color. What are the signs of good attachment of newborn to the breast of the mother? The mouth will be wide open and the lower lip turn upward. What are the other signs? There are 4 signs of good attachment are the chin touching the breast, the mouth wide open, the lower lip turn outward or we can say everted, and more areola being visible above the baby's mouth than below it. The malarial parasite are inoculated into human by Anopheles mosquito as sporocytes. ഒരു ഇൻഫെക്റ്റഡ് ആയിട്ടുള്ള അനോഫിലസ് മോസ്കിറ്റോ ഹ്യൂമൻ ബോഡിയിലേക്ക് ഇഞ്ചെക്ട് ചെയ്യുന്ന പാരസൈറ്റ് ഏത് രീതിയിലായിരിക്കും? സ്പോറോസൈറ്റ് രൂപത്തിലായിരിക്കും ഇൻ ടു ദ ബ്ലഡ് സ്ട്രീം ഓഫ് ഹ്യൂമൻ ബോഡി. The defects seen in tetralogy of Fallot include option B, that is VST, pulmonary stenosis, overriding of aorta and right ventricular hypertrophy. Explanation നമുക്ക് ചെക്ക് ചെയ്യാം. Tetra എന്ന് പറയുന്നത് that is 4. This congenital heart condition involves 4 stages. That is first one, ventricular septal defect or VSD, pulmonary stenosis, overriding aorta, right ventricular hypertrophy. 64th question. The second step in baby friendly hospital initiative is dash. It's option A, training staff on supporting breastfeeding. So under the WHO or UNICEF, there are 10 steps to successful breastfeeding. Step 2 focuses on ensuring that staff have the sufficient knowledge, competence and skill to support breastfeeding. The type of play seen in a school age child is cooperative play. Why? The school age children typically engage in a cooperative play, which involves organized activities, following rules, and working together toward a common goal, like team sports or board games. The expected weight of a 5-year-old child is dash. It is 18 kilogram. A common formula to estimate weight for children aged 1 to 6 years is age in years into 2 plus 8. This is the equation. So following this, 5 into 2, age 5 ആയിട്ടുള്ള child ആണ് into 2 plus 8, we will get 18 kilograms. The nutritional disorder due to the deficiency of vitamin C leads to dash, that is scurvy. So vitamin C is essential for collagen synthesis. Its deficiency leads to scurvy that is characterized by bleeding gums and poor wound healing. Then beriberi is B1, vitamin B1 deficiency, rickets is vitamin D, and xerophthalmia is vitamin A deficiency. Next, ICM stands for option B, International Confederation of Midwives. The International Confederation of Midwives is a global organization representing midwives and their associations worldwide. Breastfeeding should be initiated after a normal delivery within half an hour. Okay. In clinical practice and nursing examinations, it is recommended to be initiate breastfeeding as soon as possible. So ideally within 30 minutes for a normal delivery and within 4 hours for a C-section. Kangaroo mother care is indicated in dash in low birth weight babies. So kangaroo mother care or KMC is a method of care for preterm or low birth weight infants involving early, continuous and prolonged skin-to-skin contact. The job aid to NMs by providing them with readily available information and guidance is option B. ANMOL or ANM Online is a tablet-based application that acts as a digital job aid helping auxiliary nurse midwives ANMs track beneficiaries and access guidance in real time. Neural tube defects in fetus may be prevented by the consumption of following before or during early pregnancy. Option D, folic acid. Folic acid supplementation contains vitamin B9 that is essential before and during early pregnancy to prevent major birth defects of the baby's brain and spine. Fertilization of ovum and sperm occurs in fallopian tube. Fertilization takes place in the ampulla, which is the widest part of the fallopian tube. A community level strategy for convergent actions for health, early childhood development, nutrition and sanitization. That's VHSND, option C. That's Village Health Sanitization and Nutrition Day. Is a monthly event organized at the village level to provide integrated health and nutrition services. Next, what is MTP? That is Medical Termination of Pregnancy Act was passed by the Indian Parliament in 1971. And the act was enacted in 1971 to provide for the termination of certain pregnancies by registered medical practitioners. Next, IUI in infertility treatment refers to intrauterine insemination. First option, intrauterine insemination. This is a fertility treatment where sperm is placed directly inside a woman's uterus to facilitate fertilization. Next, reproductive and child health program service include the following except so option D, NCD prevention. So RCH service focus on maternal health, child health and family planning. So non-communicable disease, then NCD. Prevention generally falls under a different healthcare program. It's not related to reproductive and child health program. Next, a terminal method of contraception is vasectomy. Terminal method are permanent surgical procedures. Vasectomy for men and tubectomy for women are the primary terminal methods. 79. Taking up of cervix during labor is termed as effacement. So effacement is the process by which the cervix prepares for delivery by thinning, shortening and becoming softer. The type of abortion where fetus is dead and retained inside the uterus for a period of time is known as missed abortion. So in a missed abortion, the pregnancy is lost, but the body does not recognize the loss or expel the pregnancy tissue. Our condition is missed abortion. A positive sign that delivery of placenta is imminent is a lengthening of umbilical cord. Option A. So as the placenta separates from the uterine wall and descends, the visible portion of the umbilical cord outside the vagina lengthens. Magnesium sulfate is the drug of choice in the management of dash. Option B, preeclampsia. Magnesium sulfate or MgSO4 is the primary medication used to prevent and treat seizures or convulsions in patients with preeclampsia and eclampsia. നമ്മൾ പറഞ്ഞു ഫേസിലും അതുപോലെ സ്വെല്ലൻ ഇൻഫ്ലമേഷൻസ് വരുന്നതും hypertension വരുന്നതൊക്കെയാണ് അതിന്റെ reasons and it later ends in like affecting liver and kidney. A risk factor for cervical cancer is dash, that is HPV infection. There will be persistent infection within the high-risk type of the human papilloma virus or HPV is the most significant risk factor for developing a cervical cancer. The average weight gain in pregnancy is Option C 10 to 12 kg വരെ weight വരാം in average pregnancy. Average weight in pregnancy. While weight gain is recommendations depend upon a mother's pre-pregnancy BMI, then 11 kg can be 11 kg, roughly 24 to 25 IBS is generally considered the average healthy weight gain cited in the medical textbooks. Human milk is rich in all nutrients except there won't be iron. So option B. Although the iron in the breast milk is highly bioavailable or easily absorbed, the total concentration is quite low. Vitamin D is also notoriously low in human milk, but iron is the most common answer for the specific exam question. Baby born with weight more than 4.5 kg indicates that the mother has dash. That is gestational diabetes mellitus. 4.5 kg weight കൂടുതലായാൽ. So high blood sugar in the mother during pregnancy or GDM often leads to fetal macrosomia, which is defined as a birth weight of more than 4,000 to 4,500 grams. What is a warning sign in pregnancy? It's blurred vision. It's a danger sign that may indicate severe preeclampsia or high blood pressure. Then clausma, vomiting, and frequent urination are considered normal discomforts of pregnancy. The leading cause of maternal mortality in India is option C, postpartum hemorrhage. That's excessive bleeding after childbirth remains the leading cause of maternal death both in India and globally. The term newborn refers to within 28 days of birth. So in medical term, a newborn or neonate refers specifically to an infant during the first 28 days of life. Next, vaginal discharge within the first 3 days of puerperium is termed as, that's a stage. It's known as lochia rubra. So lochia rubra is the first stage of postpartum discharge containing blood and shreds of fetal membranes. So typically lasts for the first 3 to 4 days. Surakshita Madratva Ashwasan or Suman scheme was launched in the year of 2019, option D. This initiative was launched by the Government of India in October 2019 to provide quality health care at zero cost to every woman and newborn visiting a public health facility. First dose of injection TT should be taken in pregnancy, preferably in option A, first to third months of pregnancy. So the first dose of tetanus toxoid vaccine TT should be administered as soon as the pregnancy is registered, ideally during the first trimester. The procedure used in shoulder dystocia to ease the delivery of shoulders. That is option B, McRoberts maneuver. This is a first line clinical maneuver that involves hyperflexing the mother's legs tightly to her abdomen to widen the pelvis. Next, prolonged labor with rupture of membrane is a predisposing cause for puerperal sepsis. That's a prolonged labor and ruptured membranes increase the risk of bacteria entering the birth canal, which can lead to an infection known as puerperal sepsis. Which of the following center is the basic institution for rural health care? That we know, that is primary health center. Option D, PHC. In India, PHC is considered the basic structural and functional unit of public health system in rural areas. Under the Universal Immunization Program, how many vaccines are provided for free cost against vaccine preventable diseases? It's option C, 12 vaccines. So UIP or Universal Immunization Program in India provides vaccines against 12 diseases. Nationally or subnationally includes tuberculosis, polio, measles, rubella, mumps, rotavirus, etc. When should an antenatal mother make her second visit in the antenatal clinic? It's option D, between 14 and 26 weeks. So standard guidelines and such as those from WHO and Ministry of Health recommend the first visit within the 12 weeks and the second visit between 14 to 20 weeks and the third around 28 to 40 weeks and the fourth 36 weeks and the term. Which of the following is a lifestyle disease? Obesity ആണ് lifestyle disease ആയിട്ട് വരുന്നത്. So how obesity affects, like, is primarily caused by lifestyle factors like poor diet and physical inactivity. Scabies is infectious and anemia is often nutrition, so we can accept that options. Then what is the coverage of population in hilly or tribal areas under sub-center? The count is 3000. In India, a sub-center covers a population of 5,000 in plain areas and 3,000 in hilly or tribal or difficult to reach areas. Which of the following scheme targets adolescent girls in the age group of 11 to 18 years for addressing their needs of self-development, nutrition, health literacy, numerical skills and vocational skills? It is option A, Kishori Shakti Yojana. This scheme is specifically designed to empower adolescent girls through improved health, nutrition and life skills. So Kishori Shakti Yojana. Next question paper 2023 ലാണ്. Which among the following is not an objective of community health practice? Option B, increasing the morbidity rate. Okay, so not an objective of community health practice. ആരെങ്കിലും morbidity rate കൂട്ടാനായിട്ട് practice ചെയ്യും? No. So we can eliminate that. Yeah. National health policy in India was first formulated in 1983. This policy set the first formal framework for health goals in the country, aiming for health for all by the year 2000. Formulate ചെയ്തത് 1983 ലാണ്. Population covered under a primary health center is 2000 to 3000. A PHC typically covers 20,000 people in difficult, hilly or tribal. Sorry, it is 20,000 to 30,000 areas and 30,000 people in plain areas. ASHA worker is introduced in the country through NRHM program, that is Accredited Social Health Activist. That is ASHA full form, were launched as part of the National Rural Health Mission in 2005 to bridge the gap between the community and the health system. Next, which among the following is the mode of intervention for secondary prevention? It is option D, early diagnosis and treatment. So prevention is divided into different levels. Like primary focuses on health promotion, secondary focus on catching disease early. ആദ്യം രോഗം വരാതെ നോക്കുക, then പിടിച്ചാലും early stage ൽ കണ്ടുപിടിക്കാൻ, അതിനെ ഡയഗ്നോസ് ചെയ്യാൻ ചെക്ക് ചെയ്യുക. നെക്സ്റ്റ് ടേർഷ്യറി സ്റ്റേജ് എന്ന് പറയുന്നത് രോഗം വന്നു കഴിഞ്ഞതിന് ശേഷമുള്ള റിക്കവറിയിലുള്ള സപ്പോർട്ടാണ്. Which among the following is not a characteristic of counseling? കൗൺസിലിങ്ങിന്റെ characteristic അല്ലാത്തതാണ്. It is option C, formal conversation. So why? It's not normal conversation ആണ് അവിടെ നടക്കുന്നത്. No, it's a therapeutic process built on mutual trust, specific environmental setting and professional interaction will be there. The cabinet temperature maintained in ILRS, option A, that is 2 degrees Celsius to 8 degrees Celsius. ILR എന്ന് പറയുന്നത് എന്താണ്? Ice lined refrigerator is essential for the cold chain. സ്റ്റോർ ചെയ്യാൻ നമ്മളിപ്പോൾ വാക്സിനും ഡ്രഗ്സ് എല്ലാം സ്റ്റോർ ചെയ്യാനായിട്ട് യൂസ് ചെയ്യുന്നതാണ്. In the immunization programs, most vaccines must be stored within the specific range to remain effective. Which among the following is a group health education method? Option A, panel discussion. So posters, television and printed materials are considered as mass media methods because they reach large audience and impersonal audience. A panel discussion specifically targets a group through the direct interaction. That's why it's a group health education method. Which among the following is not a quality of health thing? Not a quality എന്നാണ് ചോദിച്ചിട്ടുള്ളത്. It's option. So it's option C, delayed adaptation. So നമുക്ക് agile ആയിട്ടുള്ള അല്ലെങ്കിൽ പെട്ടെന്ന് മൂവബിൾ ആയിട്ടുള്ള ഒരു ടീമാണ് വേണ്ടത്. So not a quality, delayed adaptation. An infected person or animal that harbors a specific infectious agent in the absence of discernible clinic disease and it serves a potential source of infection to others is called a carrier. Okay, a carrier is someone who is infected but shows no symptoms. Can be asymptomatic എന്ന് പറഞ്ഞാൽ ഒരു സിംറ്റംസും ചിലപ്പോൾ കാണിക്കില്ല, but they still can spread pathogens to others. ചിലർക്ക് രോഗം വന്നാൽ അതിന്റെ symptoms ഉണ്ടായിരിക്കില്ല, making them a significant concern in public health. Okay, so that's why infected person or animal that harbors a specific infectious agent in them, but it will be absent, clinical absent ആയിരിക്കും. Which among the following should be avoided for a good communication. ഒഴിവാക്കേണ്ടത് എന്താണെന്ന് ചോദിച്ചിട്ടുള്ളത് യൂസ് ടെക്നിക്കൽ വേർഡ്സ് ആൻഡ് അബ്രിവേഷൻസ് ദാറ്റ് ആർ നോട്ട് ഇൻ യൂസ്. അപ്പം ഒരാൾക്ക് പറഞ്ഞാൽ മനസ്സിലാവുന്ന രീതിയിൽ സംസാരിക്കാം. ദാറ്റ്സ് ദ തിങ്. ആൻഡ് സെയിം ലാംഗ്വേജ് യൂസ് ചെയ്യാം സെൻഡറിനെയും റിസീവറിനെയും. അതുപോലെ നോൺ വെർബൽ മേജേഴ്സ് അവർ നോൺ വെർബൽ ക്ലൂസ് ചെക്ക് ചെയ്യാം. ദെൻ ഗെറ്റിംഗ് ആൻഡ് ഗിവിംഗ് ഫീഡ്ബാക്ക്. ദാറ്റ്സ് എ ഗുഡ് ഫോർ കമ്മ്യൂണിക്കേഷൻ. അപ്പം ഇതുപോലെ നമുക്കറിയാത്ത കുറച്ച് നമ്മൾ ഒരു ഡോക്ടറോട് സംസാരിക്കുമ്പോൾ അവർ പല മെഡിക്കൽ ടേംസ് എന്ന് പറഞ്ഞാൽ നമുക്കത് അറിയില്ല. അപ്പം അവർ തമ്മിൽ ഉപയോഗിക്കുന്ന ഒരു ഇൻസ്റ്റിറ്റ്യൂഷനിൽ ഉപയോഗിക്കുന്ന കോഡിനാണ് ജാർഗൺ എന്ന് പറയുന്നത്. ഓർ ഒബ്സ്ക്യൂർ ടെക്നിക്കൽ ടേംസ് ക്രിയേറ്റ്സ് എ ബാരിയർ. അല്ലെ, ലാംഗ്വേജ് അല്ലെങ്കിൽ നമ്മൾ കറക്റ്റ് ആയിട്ട് ഐഡിയാസ് കമ്മ്യൂണിക്കേറ്റ് ചെയ്യാൻ പറ്റാത്തൊരവസ്ഥ നമുക്ക് അവിടെ വരും. നെക്സ്റ്റ്, an international agency devoted exclusively for the needs of children is option C, UNICEF. That stands for United Nations International Children's Emergency Fund. Its primary mission is to protect the rights and well-being of every child everywhere. Registration of the capacity to earn livelihood to lead a productive life is called vocational rehabilitation. While medical rehabilitation focuses on physical health, then where vocational rehabilitation specifically focus on training and supporting to help a person return to work or find a new way to earn a living. An epidemic affecting a large proportion of population over a wide geographical area is called pandemic. Whereas an epidemic is a sudden increase in cases in a specific area, where a pandemic happens when that disease spreads across multiple countries or continents. Example, COVID, where endemic means a disease is constantly present in a specific region. Sporadic refers to infrequent or irregular occurrence. Next, a physiological barrier of communication is option A, hearing difficulty. അപ്പോൾ ഫിസിയോളജിക്കൽ ആയിട്ടുള്ള ഒരു ബാരിയർ ആണ്, കേൾക്കാൻ പറ്റാത്ത, കേൾവി കുറവുണ്ടെങ്കിൽ നമുക്ക് എന്ത് ചെയ്യാൻ പറ്റില്ല, കമ്മ്യൂണിക്കേഷൻ അവിടെ ഒരു ഇഷ്യൂ വരും. So noise, illiteracy, language that we can manage, right? Anganwadi centers are coming under dash. Option D, ICDS scheme. So what is ICDS scheme? Integrated Child Development Services. It's the government program in India that manages Anganwadi centers to provide food, preschool education and primary health care to children under the age of 6 and their mothers. Which among the following is not an indicator of health? You can check it. It's option B, marital indicators. So not an indicator of health എന്നാണ് ചോദിച്ചിട്ടുള്ളത്. So marital indicators, it's not related to health. Yeah, health some way but not indirect. So health indicators are standard measures used to describe the health of a population, like morbidity, mortality, healthcare delivery as well. While marital status can influence health outcomes, are not a standard category for measuring public health status. Most important factor in a therapeutic relationship with a patient is trust. അറിവുണ്ടായിട്ടും അതുപോലെ മോട്ടിവേഷൻ കൊടുത്ത് പ്രൊഫഷണലിസം, മോർ ദാൻ ദാറ്റ് അവർ തമ്മിലുള്ള ട്രസ്റ്റ് ആണല്ലേ, ഒരാള് നമ്മളൊരു കാര്യം വിശ്വസിച്ച് പറയാണ്. So while professionalism and knowledge are essential, but trust is the foundation of therapeutic alliance. Without a sense of safety and trust, a patient is unlikely to be open or follow through the treatment plans. Normal response of an individual to the loss of a loved object is called dash. That's grief. Okay, so grief is the comprehensive one, where natural emotion responds to loss. While it includes symptoms like sadness or low mood, grief is the specific term used to describe the psychological process of mourning. Okay, veshmikkunna oru type, that is grief. In sewage purification, water can be sent to the natural source, after which the stage of treatment, this stage കഴിഞ്ഞിട്ടാണ് tertiary treatment കഴിഞ്ഞിട്ടാണ് നമുക്ക് natural source ലേക്ക് send ചെയ്യാൻ പറ്റുള്ളൂ. So primary treatment removes solids, secondary treatment remove in the organic matter, tertiary treatment polished ആയിട്ടുള്ള ഒരു stage that removes remaining inorganic compounds and pathogens, making the water safe enough to be returned to the natural environment. The best method of disposal of hospital waste is incineration, where hospital waste can be highly infectious and biohazardous. Also, incineration, which means burning at high temperature, is the best way to completely destroy the pathogens and reduce the volume of waste. Hospital waste. Vaccine preventable neonatal diseases, tetanus, TT. So neonatal tetanus is a serious disease in newborns. often caused by unhygienic umbilical cord care. It's highly preventable by ensuring mother is vaccinated with the TT vaccine during the pregnancy, which passes protective antibodies to the baby as well. What is blue baby disease found in infants is due to which of the following chemical is excessively present in drinking water? It is in option C, nitrates. When infants drink water high in nitrates, it interferes with the blood's ability to carry oxygen. This leads to a condition called methemoglobinemia. This leads to a condition called methemoglobinemia, which gives the skin a bluish tint, commonly known as blue baby syndrome. Deficiency of vitamin C result in scurvy. We have discussed it. Children with pot belly is an indicative of kwashiorkor, swelling ഉണ്ടായിരിക്കും. So, it's a form of severe protein malnutrition. Then, the weight of the human body is mainly made up of water. Okay, most of the part. Water is the primary component of the human body. In average adults, water accounts for roughly 60% to 70% of total body weight found within cells, blood vessels, and between tissue. Absolute contraindication for intrauterine device insertion includes all of the following except diabetes mellitus. Modern medical guidelines do not consider controlled diabetes an absolute contraindication for IUD use, where women with diabetes can safely use both hormonal and copper IUDs. Part of the body which is responsible for regulation of body temperature is hypothalamus, that act as the body's thermostat. It monitors your internal temperature and sends signals to trigger cooling process like sweating or warming process like shivering to keep your body temperature stable. During pregnancy, the first fetal movements can be felt by the mother at second trimester, known as quickening. These first movements are typically felt between week 16 and 24. While the fetus moves earlier, it is usually not strong enough for the mother to feel until the second trimester. Oral polio vaccine given at birth in case of institutional deliveries as zero dose. In many national immunization schedules, the dose given at birth is called the zero dose. It is designed to provide early intestinal immunity before the regular 3-dose primary series begins. Which of the following is a vector-borne disease? It's malaria. So, yeah. Vector-borne disease എന്ന് പറഞ്ഞാൽ mosquitoes and other fly sticks ഒക്കെ പരത്തുന്നതാണ്. Malaria is transmitted to human through the bite of an infected Anopheles mosquito. The other options, scurvy, rickets, anemia, are the nutritional deficiency diseases. The purpose of Heimlich maneuver is to remove a blockage in the victim's airway. So, the Heimlich maneuver or abdominal thrust is an emergency technique used to help some who is choking. It uses air forced out of the lungs to dislodge an object blocking the windpipe. What should be your first action while giving first aid to a victim on electrical shock? It is to ensure the contact with electrical source is detached. Also, safety is the absolute priority. You must never touch someone who is still in contact with a live current, or you will become a victim of yourself. You can use a plastic chair or anything other than iron. Your first step is to turn off the power or safely move the source away using a non-conductive object like a wooden or broom handle. Pulse polio immunization covers the age group of children between 0 to 5 years. Next, the lateral position is given to a pregnant woman in order to prevent supine hypotension, where a pregnant woman lies on her back, which is known as supine. The heavy uterus can compress the inferior vena cava. This reduces blood flow back to the heart, causing a drop in blood pressure known as supine hypotension syndrome. Turning to the side or lateral position relieves this pressure. A clinical thermometer indicates temperature in degree Fahrenheit from minus 95 degree Fahrenheit to 108 degree Fahrenheit. For standard clinical thermometers are designed to measure human body temperature variations, typically ranging from 95 degree to 108 degree Fahrenheit. Sorry, not minus, it's just positive only. Visual acuity can be assessed with Snellen chart. So what is Snellen chart? It's a standard tool used by the eye care professionals to measure how well you see at a distance, or visual acuity. An ophthalmoscope is used to look at the back of the eye, and a goniometer measures joint range of motion. So check these terms. Universal recipient blood group is AB positive. They can receive blood from any other groups. Isotonic normal saline contain sodium per 100 ml. So it's option B, 0.9 percentage. Isotonic normal saline is a solution of 0.9 sodium chloride NaCl. This means there are 0.9 grams of salt for every 100 ml of water, which matches the concentration of salt in human blood and tears. One ounce is equal to 6 teaspoons. Which of the following is a congenital disease? Sickle cell anemia. So congenital disease is a condition present from birth. Sickle cell anemia is an inherited genetic disorder. In contrast, goiter and kwashiorkor are typically nutrition deficiencies, and diphtheria is an infectious disease. Degree of resistance against a pathogen is known as immunity. Option A, were the body's ability to resist or defend itself against specific pathogens like bacteria or viruses and prevent disease. Next, route of administration of measles vaccine. ഏത് വഴിയാണ്? Given by subcutaneous. The measles vaccine, often given as MMR, measles, mumps and rubella, is a standardly administered through a subcutaneous injection, which means it is injected into the fatty tissue layer located below the skin. All current diseases cases, old and new, existing at a given point of time or over a period of time in a given population refers to prevalence. You can check the explanation here. Which of the following is the main target of family welfare programs? Option A, couples in the fertile age.